Hi, my name is Methotrexate and I'm going to talk about acute methotrexate-induced crystal nephropathy. Definition. Drug-induced crystalline nephropathies are secondary to abnormal accumulation of crystal leading to the parenchymal renal injuries. Methotrexate is used to treat a wide range of malignancies and it is one of the multiple drugs used for this condition.
Here are 5 things healthcare professionals should know about drug-induced kidney injuries. First, there are 3 main ways that drugs damage kidneys. Some drugs decrease how much blood flows to the kidneys. Examples include NSAIDs, ACE inhibitors, and ARBs. Some drugs directly injure kidneys. Examples include penicillins, cephalosporins, contrast dyes, and aminoglycosides. Some drugs also obstruct the flow of urine from the kidneys. A common cause is calcium stones from excessive or high-dose calcium supplementation. Second, patients at higher risk may include those aged 60 or older, experiencing dehydration, with diabetes, high blood pressure, pre-existing kidney disease, heart failure, or liver failure, or having recently had surgery or a procedure that used contrast dye. Third, symptoms can occur days or months after starting a new drug. Most mild to moderate kidney injuries do not have any symptoms. People with a severe kidney injury may complain of feeling tired or confused, a sudden increase in blood pressure, a sudden change in urine output, or swollen ankles and weight gain from fluid. Fourth, the most useful lab markers are an increase in serum creatinine by at least 27 micromoles per liter in 24 hours or by 50% in 7 days, a drop in eGFR by 25%, and/or a decreased urine output. Finally, patients who experience a drug-induced kidney injury may need to have their medication doses decreased or stopped altogether.
Applications in medicine. Acute renal failure occurs in approximately 2% of the patients who receive high doses of methotrexate for the treatment of a hematological cancer. Despite the frequency of acute renal failure and the occurrence of distinct urinary crystals in this context, the presence of these crystals in the human tissues has not been clearly documented. It is described crystal within the kidney tubules of a patient with methotrexate-induced nephropathy.
Methotrexate is commonly used to treat rheumatoid arthritis and many other autoimmune and inflammatory conditions. In fact, it's the first line of treatment for most people after they're diagnosed, and it serves as the gold standard against which other treatments are evaluated. In most people, methotrexate does not cause any problems. We also give a prescription for a vitamin called folic acid to take every day while you are on methotrexate. This helps to cut down many of the possible side effects. Sometimes another vitamin, folinic acid, or leucovorin, is also used. Methotrexate can infrequently have some effects on the blood, like lowering white blood cells and red blood cells. Methotrexate is also metabolized in the liver. To be sure there are no problems with your liver, blood tests will need to be done, and usually this is about once a month when you first start methotrexate, and then when you're on a stable dose, this usually spreads out to about every 3 months. Minor side effects might include hair loss, which is temporary and reversible, loss of appetite, nausea or vomiting, headaches, and feeling foggy or unclear, and typically that's the day after taking the methotrexate. Sometimes mouth ulcers will occur. Most of the time, these will lessen as your body gets used to the methotrexate, but if side effects continue or really become troublesome, check with your doctor or nurse. Get emergency help if you ever have any signs of an allergic reaction, like hives, difficulty breathing, swelling in your face, lips, tongue. That's very, very rare though. Methotrexate can sometimes, rarely, cause and inflammation in your lungs. If you experience a cough or shortness of breath, let your doctor know. Methotrexate is not associated with an increased risk of cancer, but it's important to recognize that people with autoimmune diseases do have a risk for cancer anyway, just because they have an autoimmune disease. There are some medications you should generally avoid with methotrexate. Trimethoprim, Bactrim, or Septra acts on some of the same pathways, and methotrexate may need to be held while you're on those medications. There is a possible interaction with anti-inflammatory drugs like ibuprofen or naproxen. However, many people with RA take those on an ongoing basis, and blood tests ensure that there's not a problem.
Now have pros and cons. Pros. 1. Methotrexate treats cancer by slowing the growth of cancer cells. 2. It treats psoriasis by slowing the growth of skin cells to stop scalp confinement. And 3. It may treat rheumatoid arthritis by decreasing the activity of the immune system. Cons. Methotrexate may cause very serious life-threatening side effects. It may cause liver and lung damage, especially when it is taken for a long period of time. 3. It damages the lining of the mouth, stomach, or intestines. And 4. It increases the risk of the patient to develop lymphoma.
Hi, I'm Dr. Tom Palella, a rheumatologist with Rheumatic Disease Center Physicians. What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.
Issue apply in Ecuador. In Ecuador, methotrexate is used, but the patient suffers some consequences in their health, and for this reason, more studies must be done so patients could have more treatment options. Conclusion. Methotrexate may cause very serious effects. You should only take it to treat cancer or certain other conditions that are very severe and that cannot be treated with other medications. Thank you.